Hello, and welcome to Hard Conversations. This is a podcast about male sexuality, intimacy, and sex positivity, where we unpack the taboo topic of erectile issues in a safe, non-judgmental space. And now, here's your host, sex therapist, Timothy Norton.
My next guest is Max McCullen, who has worked in the sexual health field for 18 years. He worked for Boston Medical Group, GlaxoSmithKline, and a host of urologists all over California. He completed undergraduate studies at the University of the Pacific and the University of London. And then his research led him to the Institute for Advanced Study of Human Sexuality in San Francisco. He has his doctorate degree in gender studies and human sexuality from the Institute and currently works for Boston Scientific. Welcome, Max.
Thank you, Tim. Great to be here.
Yeah, I'm so excited. So how did you find your career path? How did you get into sexual health?
That's a great question, and I'm not really sure. I can't pinpoint one exact thing that happened. I've always been very interested in human sexuality. I think the first time human sexuality hit me, and this will date me a little bit, but I was watching the movie Grease in the theater, and when I saw Olivia Newton-John come out in the black tights, I realized what all the men and women were talking about and fighting about, and why my parents didn't get along. And I realized the power of sexuality from Olivia Newton-John, so it probably started right there.
Okay.
So after that, I just was always interested in it, and then did some undergraduate work in it, and realized that when I started, I actually researched graduate degrees in human sexuality in the state of California and couldn't find one UC school or one state school that offered a graduate program in human sexuality. And I thought that was so funny, because what field of study affects us more impactfully than our own sexuality, right?
Yeah.
It kind of almost imprints everything we do.
Definitely.
So I found the Institute in San Francisco, which obviously wasn't a UC or a state school, but they were doing some of the best work at that time. And so I started to study there, and then got involved, as you already mentioned, with the medical side of things.
Yeah.
And that kind of brought me to where I am today. I'm still treating men for sexual dysfunctions medically.
Right. And that's actually why I was really excited when we met. It's because in my current social circles, I meet more of the mental health practitioners, sex therapists. I mean, a lot of sex educators. So I don't have a lot of access to that information regarding things like surgeries and Viagra and all the different medications outside of books and outside of just, lectures that I go to and things like that. So I'd like to talk a lot about that today, and, and what you've done and the kinds of things that the options for guys struggling with erectile issues.
No, absolutely. And when you approached me, I'm the complete opposite, right? I'm always around the medical personnel, so I don't get to interact with the great work that your side is doing on how to help men out, psychogenically. So, yeah, I think this could be an ongoing discussion for a long, long time.
Yeah.
It could be fruitful for both of us to learn exactly, what we do. And I guess the goal, and this is kind of what you mentioned, is if you can bring those two worlds into a synergistic treatment paradigm, then that would be really impactful for men, because they're both a huge part of it.
Absolutely. And I think we need more of it throughout medicine, throughout mental health, however you want to distinguish it. But especially with sex, I've looked at a lot of websites of a lot of urologists, and I don't see them mention anxiety reduction or therapy a lot of the time. And it's unfortunate.
It is.
Because even if there is a real obvious biological cause, which oftentimes there is,
sure,
it helps.
Well, and even if there is, biological causes, which we're going to talk about, but of course that's going to affect you
emotionally as well.
Absolutely. It's going to affect you. So,
all right, well, let's get into it. So one of the first typical medical treatments that you mentioned is PDE5 inhibitors.
Right.
What is that?
So basically what generally happens, and I think this is a pretty normal course for most men, is they will bring up to their primary care physician that they're having an issue, and the primary care physician will generally give him a prescription for Viagra. Many times they will refer him to a urologist. But generally what's going to happen is the primary care guy is going to give him the Viagra. Unfortunately, a lot of those primary care guys don't follow up. So hopefully they are, if it's a good primary care, and let's say 6 months, hey, how did that Viagra work out? Because a lot of guys just give up, but it doesn't work. And then they'll go to a urologist and then, go down the whole treatment paradigm that we'll go into later. But to answer your question, a PDE5 inhibitor is essentially a medication that causes nitric oxide to be put into your system, which has a kind of dual action. It's a muscle relaxer, and then it's also a vasodilator.
Okay.
And
a vasodilator.
Yep. So basically,
that sounds to me like it makes your veins wider.
That's exactly what it is. You nailed it. Yeah. Where'd you go to medical school? Yeah, you nailed it. So opens up the two corpora cavernosum in your penis and allows blood to go in there. So first it relaxes the muscle, and then it ends up, once the blood goes in there, it's able to cinch up the bulbar cavernosus muscle so the blood doesn't leak out. So it kind of traps it in there for a little while. Okay. And what's interesting is Viagra was a complete mistake, as a lot of things are in science. Pfizer was doing a study on pulmonary hypertension. And the people, once they started to interview people about the study, everyone started to say that hey, doc, I can breathe better, but guess what else is happening? So Pfizer went ding, 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 multi-billion dollars later, they got the indication for ED. So it was a complete mistake that they came up with Viagra. But so Cialis and Levitra you don't really hear about anymore. I used to sell that to GlaxoSmithKline, but they're all the same medication. They're all called PDE5 inhibitors, phosphodiesterase 5 inhibitors, and they have the same basically mechanism of action. It's just like a delayed onset. So you would be like a Tylenol delayed reaction.
Yeah, and I've read about this phenomenon before of vasodilation, and at a glance, I think it's counterintuitive because we're talking about relaxing a penis when guys in that moment kind of want the opposite, right? They want an intensification of the penis, and they want it hard. So can you shed any light on how that works or why the paradox with that?
Well, I mean, I think that's a great question, and maybe some of the anxiety that men do go through could cause that to be an issue because they're not able to relax so that's kind of counterintuitive, but your muscles have to relax for the blood to flow into the penis.
Okay. And
that's an important component of how Viagra works. Is it relaxes the muscle, and then the muscle, once the blood goes in there and the penis becomes engorged, it wants to stop venous leakage. There's a term that urologists will use called venous leakage. That means the blood can get in there, and most men have experienced that, right? You get hard in the beginning, and then all of a sudden, throughout the course of you having sex, things kind of start to slow down a little bit. Well, that basically means that you're not keeping the blood in there. That's why people use penis rings, by the way, because as we get older, the venous leakage can start to happen more often. So I'm not sure if I answered your question.
You answered my question perfectly. Okay. And so different PDE5 inhibitors, they'll either slowly make the vasodilation occur, right, or all at once kind of.
Right, exactly. So Viagra has a little bit of a quicker onset of action, and then Cialis is delayed over time. So the whole way that the Cialis, the way they market their medication and the way they've designed it is that it's a delayed release, extended release. So for instance, you're able to have sex like over the course of a couple days, and it stays in your system. Like pharmacologically, it means it has a larger half-life. I mean, we don't have to get into all that, but it just means it stays in your system a little bit longer. Viagra gives you that instant boom, and you're going to have probably a bigger reaction quicker, but then it's going to die over time. So in, let's say 8 hours, that Viagra probably isn't going to kick in as much, whereas the Cialis will stay in your system a little bit longer, but it won't give you the initial erection that in terms of my experience, that Viagra gives you.
Okay. So we could almost say like one night sex, Viagra, weekend sex, Cialis.
Exactly.
Okay.
Yeah, I think that's a great way of looking at it.
Okay. And so you worked with those medications for a long time, or worked with guys who had varying degrees of success with those medications. What did you notice? Were there some guys that could just take it forever and it was fine, and maybe other guys that couldn't? Like what happens?
That's a great question, and I don't think people realize that. And is that 50% of men cannot tolerate PDE5 inhibitors.
Oh, wow.
So 50% of men either, I should say 50% of men, I misspoke, 50% of men can't get to goal on PDE5 inhibitors. Now, what that means is they may be on nitrates, so it's, it's a health concern, so they can't take it, right, because it lowers your blood pressure so much. Or they have an adverse reaction. A lot of guys have flushing. Like my dad, for instance, has really bad headaches. He can't take Viagra. Or simply there's an issue over time because Viagra works, like I said, with your vasculature, right? So increasing blood flow to the penis. Well, if you're having other like comorbidities like diabetes or atherosclerosis, which or hypertension, which causes issues in your vasculature, the effect of Viagra will diminish over time. So 50% of men that try Viagra, they're not going to get to where they want to go.
I see. Okay, they don't exactly say that on the commercials.
They do not.
Okay.
Yeah.
And this goes without saying. This podcast is in no way a medically sponsored
not sponsored
podcast.
by anything.
We're not saying go out and take Viagra.
Wait, are you saying Pfizer's not going to write me a check for this interview?
Pfizer is not paying Max nor myself for this interview.
Right.
And you do always want to consult your medical doctor when taking any of these medications. Although in London, they've started selling sildenafil. They've started selling generic Viagra over the counter.
See, that to me, I have heard rumblings about that. And to me, that seems... I think there's got to be some sort of a thing where a doctor's writing off on it somewhere, because if a guy walks in that has heart failure or is on nitrates and he hasn't consulted a physician, that guy could die. So I feel like there's got to be a discussion or some sort of a prescription or something like a prescription, or at least a consultation.
Okay.
I don't think the United States is so much more litigious than Europe. Over here, I don't think it would fly because you'd have to have that consultation, because it can be dangerous for a certain type of patient. But I have heard that. I need to look into that and see exactly what's happening. So tell me what you...
I've just seen the headline, brief articles, tweets, and things like that. But I got the sense that they were going in and seeing essentially a pharmacist.
So maybe that's a consultation, and the pharmacist is saying, "Hey, you realize that if you're this patient, it's not to your benefit." So maybe that's what's happening.
Yeah.
I feel like that wouldn't fly in the United States.
Yeah.
What do you think?
I think we'd be a long way away from that.
Yeah.
Although now there are these startups where you can get your generic or regular pills online.
Correct.
Seeing a virtual
doctor.
urologist or virtual...
Yeah, like telemedicine is stuff that's happening now. It's growing more and more rapidly, and so that's happening. Yeah, and the good news is the other problem with Viagra is it's really expensive. Right. I mean, as we all know with drugs, branded drugs they have the best efficacy, but they're also expensive. So there are generic options for people. I do work with a company that distributes generic sildenafil, which is actually indicated. Remember earlier when I talked about that it was originally for pulmonary hypertension? So this medication's indicated for pulmonary hypertension, not erectile dysfunction, so they can get it a lot cheaper. So if any of your listeners, want to, just go into their urologist or primary care and ask them for the generic form of sildenafil, which is the chemical name of Viagra, their physician should know that. At this date and at this time, people should not be paying retail for Viagra. There's other options out there.
Okay, and it's literally the same product.
I mean, I would say it's probably the efficacy is going to be a little bit better with the branded, but you're going to pay 3 to 4 times.
Right.
So why not take 2 pills of the generic that's going to save you $50 to $100 as opposed to taking 1 pill of the branded?
Okay. Well, good tip. So so you work with guys in various capacities, and so you see them, and at some point, pills aren't working. They go to a urologist, and there are other options. There are other medical options.
Correct.
So next on the list that you mentioned was injection therapy.
Yes. So
that sounds. I don't want an injection there.
When I heard about that option before I went into it and really saw it done, and I haven't had it done, but I've obviously been in the room many times. I was pretty much freaked out about it. I said, why would anybody want to do that? But believe it or not, they do it in a part of the penis that has little to no nerve endings in it. So there are, as we all know, there's certain parts of the penis that are more sensitive than others, and they do it at the 9 and 6 o'clock sides of the penis, and they use a very, very thin diabetic needle, so what you would inject insulin into your stomach with. Mm-hmm. And the guys, from what the patients that I've talked to, it feels like somebody slaps a rubber band, medium strength, onto the penis. So it's a little bit of a prick, let's say, no pun intended, but it's not very painful at all. And it's the efficacy, in meaning how good it works, is off the charts. I mean, you're gonna get an erection.
Oh, okay. What are they injecting into your penis?
So there's a bunch of medications. Again, these are vasodilating medications. They're used for other things, but the names of them are prostaglandin. The branded name would be Caverject. That might be some of your listeners will remember having a doctor talk about Caverject. There's atropine, phentolamine, and they use these just for different medical reasons, but they just basically increase blood flow to those certain areas. So the doctors refer to it as trimix. So a lot of times if you go to urologists, that's the term that they will use, because it'll be prostaglandin, atropine, and phentolamine, which they will put together in a mixture and then inject that into the penis.
Okay.
Yep.
And so how long does it last? How long does the injection have? Yeah.
And so part of the reason why injection therapy became, first of all, it was around before Viagra. Okay. So they were using it and perfecting it even before Viagra came onto the scene, which is like right in the 80s and early 90s. And then obviously kind of fell out of fashion because Viagra started working so well. But as we talked about, a lot of men aren't going to get to go on Viagra, and you have immediate erection, and it doesn't have to go through, your first pass metabolism. So you're going to have less side effects. Viagra can have side effects, and depends on what you've eaten. So if you're putting the medication right there, boom, you're going to get an erection, and it's going to last for about 45 minutes to an hour. There are drawbacks, of course, right? Some guys don't like needles. You have higher risk of priapism, meaning an erection that won't go away. That can be very dangerous to the tissue. We've all probably heard the commercial, the Viagra commercials. If you've had an erection for longer than 4 hours, go to the emergency room. It can cause tissue death. It's very, very dangerous to have an erection that won't go down. That can happen way more likely with injection therapy. So you have to kind of know what you're doing. That's why a lot of times when you go into a urologist, they'll do it in the office, kind of show you how it's done, and you'll get a partial or 3/4 of erection, and then they'll discuss how you can do it at home.
Okay. All right. So and then how much do those cost?
So the cost is generally going to be higher than Viagra, or of course the generic. I would say generally they're going to sell you a 6-month supply, and it could be anywhere from $500 to $1,000.
Okay, 6 month supply, figuring you're having sex
like 3 to 5 times a week.
Okay, yeah. Okay, so.
I don't know how you'd break that down cost-wise, but that's generally they sell them in like lump packages because it's just not profitable for them, I guess, to do it any other way.
Okay.
The other problem with the injection therapy is they have to take, because they're pulling different medications from different pharmacies or compound pharmacies, the supply is an issue. So I've had that be a problem where urologists have asked me if I know pharmacies that do this. I would set them up with a pharmacy, and this has happened more times than I wanted to deal with. Is they said, hey, they're having supply issues with one of the medications that I combine. So then the patient basically was out of luck. So he had to wait until they got enough of the medication there to combine it. So then they had the medication ready. There's also sterility issues. It has to be refrigerated, right? You can't like leave it in your car on a hot summer day and then use it. It has to be kept at a certain temperature. Whereas if you have a pill, you can leave it in your car. You can take it whenever you want. So traveling is an issue, right?
Right.
Because you have to have a needle and a syringe and all that. So.
Okay, interesting. And then, so for the guy who doesn't want the pill, guy doesn't want the injection, what's next? You mentioned a vacuum.
So the vacuum and the injection, I would say, are kind of like the second A and second B. Sometimes urologists are going to go for the vacuum device before the injection because it can work at times synergistically with Viagra. So remember when we talked about venous leakage earlier? So the guys can get hard and maybe it doesn't stay hard, or maybe the Viagra is just kind of working halfway, but you're getting a little bit of extra blood flow. Mm-hmm. So now what you can do is you can put a suction device on the penis, and basically that just literally physically pulls the blood into there because you're forcing it. And then there's a ring at the end. So basically you put a cylinder over your penis. You want to create an airtight seal. Some of them are handheld. Back in the day, like 50 years ago, it would actually be a pump that you would do manually with your fingers. Mm-hmm. But now they have battery powered, and you basically turn it on. It does make a noise, so it's not very sexy, right? Mm-hmm. You wouldn't want to do it in this. It's not discreet if you're going to do it next to your partner. Mm-hmm. So you'd basically, have to get up, probably go in the bathroom. It kind of makes a little bit of a humming noise as the battery kicks in. There's a button that you push. It kind of goes. Literally physically sucks the blood into there, and then before you put the cylinder over your penis, you put a rubber ring around the tip of it, and then you just slide that ring off the cylinder onto the base of your penis, and that keeps the blood in there. It maintains the erection, and then you can have sex.
Okay.
It's not very comfortable. I did try one of these because obviously when I was talking to patients, I wanted to be able to know what it felt like. Mm-hmm. I didn't want to inject myself to know what it felt like, so I didn't go that far. But it's not. It was uncomfortable because it feels like this cinching feeling. So even though it does work, it's not sexy. It's kind of embarrassing. It's not very discreet. But there's no side effects, right? You don't have to worry about any of the side effects with Viagra. You don't have to inject yourself, it's pretty benign if someone does not want to use any medication at all. Mm-hmm. That could be an option.
And I imagine from like a sex positive viewpoint, you could play with your partner could get comfortable with the machine.
It could be a fun experience to play around with it. Absolutely. You could try it on, if you're with a female, you could try it on her. If you're, two males, obviously they could have fun with it. I mean, so that's a great point, and it could be something that you can incorporate into your
right. I think I heard people talking about that at like a talk on sexual disabilities, like people who have sexual disabilities.
Absolutely,
like, that's going to be something that's
a great option. Yeah.
Right. Okay. And well, a funny side note, I was at a blowjobs class as we end up at classes in this field.
Was there fruit around the class? What was it?
It was all kind. Yeah, it was at the pleasure chest.
Okay.
And
you had like prosthesis and dildos and stuff.
Oh, all kinds of toys.
Okay.
But the instructor mentioned that there's a blowjob technique that basically mimics a vacuum.
Oh, interesting.
That of just sucking the blood.
And so you're probably creating an airtight seal because that's if you don't do that, the suction, the whole premise, right? So you'd have to be probably pretty far down,
right?
On the
well, but while the penis is flaccid, that wouldn't be as hard or difficult. And then so I haven't actually seen it, but he swore by the technique, and it was certainly compelling.
Interesting.
So for all you
blowjob aficionados
givers out there that you might have a new calling. So next along the list, you mentioned something I haven't heard of: pellet therapy.
Yeah, pellet therapy. Let me back up for 1 second.
Okay.
The one thing I wanted to throw out there is that when I mentioned that you can use a vacuum erection device synergistically with Viagra or Cialis, one thing you would never want to do is use it if you're doing injection therapy.
Oh, okay.
Yeah, because it's gonna increase your chances for the priapism.
Okay.
So if you're injecting Trimix into your penis and you're not getting an erection, there's something wrong with the medication, and I would not jump into a vacuum erection device. Also, it could be maybe it's taking a second to kick in. Next thing you know, you start using the vacuum erection device, you get too much blood in there. So just to throw that out, there's a caveat to listeners who would want to try that with injection therapy. Only use the vacuum with Viagra.
Okay, good. Thank you. That helps. So pellets.
So pellets, yeah. So
what
this
is
is called. So this is a brand name called Muse. That's maybe what people would remember it by if a doctor ever brought it up. Essentially, what it is, it's a trocar, which would be a delivery device. It's basically has a small opening. It's kind of like a turkey baster, but very small. And it's basically the same medication, has prostaglandin in it, which is the same main medication that you would put into the injection therapy. But for people who don't like needles, you would actually put a pellet intraurethral into your penis. So
through the hole,
through the hole of your.
So you're doing it yourself.
Correct.
Okay.
So you would just put the end of the delivery device or the very small turkey baster into your urethra, deposit the pellet, and the pellet dissolves into the tissue, and you get the vasodilation by having the immediate topical application of that medication. I haven't had it done or seen it done, and I've heard that it's painful. I heard it's actually more painful than the injection, than the needle. Yeah. So
and
it's not as popular anymore.
Right. Okay. Not as popular anymore.
But you know, there's always a patient that's like deathly afraid of needles, right?
Sure.
Viagra doesn't work. Doesn't want to do the vacuum device because he thinks it's embarrassing, right? That's the guy. And so there's going to be that guy out there that's like, hey, that's for me. And maybe he's not as sensitive.
Maybe he's into urethra play, right?
Exactly.
There's a whole section at a lot of sex stores for urethra play. And They might like the pain in there. They might not mind it. It might not even bother them at all.
Exactly.
Okay. So then hormone replacement.
Right.
Okay.
So, you know, we've all kind of heard of this, I'm sure. There's commercials ad nauseum about it. Essentially, as we get older, after 40, we lose 10% of our testosterone production a year. Testosterone's so important for... definitely women have testosterone as well, but for men, you know, our mental acuity is tied into our, testosterone, our muscle formation, muscle retention is all tied into testosterone, and of course, your sexual functioning is tied into testosterone, energy levels. You definitely want to go get your levels tested before you do this because. There's I'm trying to think of one of the medications, but maybe you would remember too. Well, they say, take this pill and it increases your testosterone. I see commercials about it all the time. It's kind of dangerous because what happens is you run the risk of your body, basically what your body is going to say, oh, well, I have all this now free testosterone running around that you've put in artificially, and then your body will stop producing natural testosterone, and you run the risk of your body totally shutting down and not producing any more testosterone, which is worse. So,
oh no,
yeah, you don't want that to happen. So, what you want to do is, I would recommend any guy over the age of 40 to go get your testosterone levels checked. You can go to your primary care. You can go to like any sort of nephrologist or endocrinologist. Probably do it more so than anybody, but any primary care will know how to do it. And he'll come back and he say, yeah, it's a little low. Or, hey, guess what? You're really low. And then you're like, boom, well, that's the problem. That's my problem right there. It's not that I'm not turned on by my girl. It's not that I have vasodilating problems. It's that I'm producing absolutely no testosterone. So that's an option, but you're not going to know that until you get your levels checked.
Okay. And so is there a connection between testosterone and blood flow? So it's funny because as far as my research has like
basically shown me is that there's still some question marks about erectile dysfunction. What we do know is there's like 5 key components to getting an erection.
Okay.
You have to be visually stimulated, right? If you take a Viagra pill, for instance, that has to work with the rest of your body, right? Not the injection, but if you take a Viagra and you go to an insurance seminar, you know, and there's nobody that you're attracted to in the room,
And you don't have insurance seminar kinks.
that's not your paraphilia.
That's not
Is
right.
insurance.
All right.
You are not going to get an erection. So
Okay.
men, we have to be. It has to start here. I'm pointing to my head for the viewers at home for anything to work. So that's number one. Number two. Your brain kicks in your endocrine system or your hormonal system. So the testosterone picks up, your dopamine, your serotonin levels start picking up. You know, as we all know, when we're turned on, you feel good, right? Like if I look at a picture of a beautiful woman, I feel good. I feel kind of like, hey, that's because your serotonin levels just jumped up, right? So your testosterone levels jump up, and what that does is that kicks in the rest of the mechanisms which now start your nerve innervation. So you have to have the nerve impulses have to go down and talk about those muscles relaxing and opening up, and then the blood flow. So all these things have to happen right at once. You have to be turned on. You have to have hormonal output. You have to have nerve innervation, and you have to have vasodilation of you. So to think about that, it's pretty amazing what our bodies go through. And I don't know if women really appreciate what's going on physiologically.
It's complicated.
It's complicated. So I think men need to give ourselves a break, right? Because that's a lot to go. And as you get older, right, none of us run as fast as we did when we were 16. We can't lift as many weights. So listen, give yourself a break that, hey, I don't get as hard as I used to, but there's a lot of things going on in my body. And there's options out there to get me to the point where I can maybe not be like I was when I was 15, but I can still have sex and have a great time and have a great sex life, right? So, there's a lot of things going on. And to answer your question, we don't know exactly which one's going to carry the load more, but we do know testosterone is a key component.
It plays a part.
We just don't know if it does more innervation than vasodilation or more this or that or whatever. So there's still some question marks.
Okay, and then finally, and this is this last technique, this last process is what you do a lot of lately.
Right.
Are the implants, surgical implants.
Correct.
For the viewers at home, you can't see him. He is in scrubs.
My sexy scrubs right here. Yeah.
And because as a part of your job, and you mentioned this earlier, you attend these surgeries.
Correct.
You are present to these surgeries. Why?
Two reasons, really. The devices are very, very expensive. So they want a representative of the company to be in the room in case, let's say you didn't have a representative there and the scrub nurse opens up the device and drops it on the floor. Well, now it's not sterile anymore. Well, that's a $8,000 piece of equipment. So the hospital might be in a discussion with the manufacturer saying, "Oh no, yeah, we didn't use that.
A defective one."
So if the rep's in there, now it's our responsibility. If it gets dropped, it's on us.
Okay.
So we're responsible for all of that. The other thing is that surgeons, doctors know a lot about a lot, right? And they're dealing with prostate cancer. They're dealing with urinary issues, bladder issues. They're dealing with a whole erectile dysfunction. They're dealing with female urology, all this stuff. And so they might not do this surgery more than once a month or once every 2 months. So we're supposed to kind of just be in there in case that doctor has any questions. Hey, by the way, how much am I supposed to fill up the reservoir for? Well, it's you want to fill it up to at least 65. And so just kind of to be there in case. And also the scrub nurses do a lot of the prepping of the devices. So you need to be there to kind of walk through them with that process if the doctor's doing his surgical techniques to get ready to implant the device. So basically you're just kind of there to make sure everything's kosher.
Okay. And so these implants, tell us more about them. I think everybody, to get an idea, should probably Google pictures of penile implants and
you know
what they look like.
I'll leave one. I have one with you today. We can take some pictures, and
sure.
I can actually give you one right now. So you can kind of maybe. This is basically I'm handing Tim one right now, so you have that in your hand, and that's a penile. That's a penile implant, and we'll take a picture of that, and you can put that on your website so people can see. And of course, they can Google it. If you Google Boston Scientific penile prosthesis or American Medical Systems penile prosthesis, there'll be pictures and videos that you can pull up and take a look at. Essentially, the main device that is the best-selling device now is called a 3-piece penile prosthesis.
Okay.
And there's a reservoir or a balloon that you put in your abdomen. Mm-hmm. There's a pump that goes into your scrotum, and then there's 2 balloons that go into your corpora cavernosum. So the penis is made up of 3 basic cavities. Your corpora spongiosum is your urethra, so that's where you urinate and ejaculate out of. And then there's 2 cavities below that, which is your cavernosum, and that's what fills up with blood.
Okay.
So that's how you get an erection. What the doctors do is they go in, and it's kind of brutal to watch, actually. They take dilators and just work all that tissue out of there, and they just kind of basically just slough it all aside.
And Max is making kind of a punching, grinding motion, like they're literally clearing out
the tissue.
Out of the penis.
And they actually don't bring any tissue out, which is interesting, but they're really aggressively just opening up these cavities.
Where's the incision?
So the incision is mid glands under the penis. So let's say the scrota, it's in between the scrotum and mid penis. So so let's say the top of your glands, which is where your helmet is, 2 centimeters below that on the underbelly of your penis, and about 1.5 centimeters above where your scrotum starts. They make 2 incisions right there.
2 incisions.
Mm-hmm.
One
because
for
again,
each.
they're putting 2 balloons in there.
Right.
So these 2 balloons are going in there, and they shod them because they want to make sure that there's no bubbles through there, because basically what runs on saline. So to get the erection, they're moving saline in between these 3 parts of the device. So the pump, the balloons, and the reservoir. So when you pump the pump, it transfers the saline from the balloon or the reservoir, which is in your abdomen, into the cylinders, which are in your penis. Mm-hmm. You get an erection. Mm-hmm. When you're done having sex, there's a deactivation button that's in your scrotum. You push the deactivation button, and you, with your hand, gently squeeze the penis downward, and that transfers the saline back into the reservoir into your stomach. Mm-hmm. And then it sits there until you're ready to have sex again.
Okay. And you described this to me before, and also described it pretty flatteringly, with guys saying they had wonderful results with them.
I was literally shocked. So when I sold Viagra and when I worked with other urologists, and we would do a lot of clinics where I would show people how to use the vacuum devices, I would mention this, and I didn't realize how high the patient satisfaction was until I actually started interviewing urologists that were doing a lot of them, urology surgeons, and then talking to patients afterwards. It's got about a 90% patient satisfaction rate.
Wow.
And then they interviewed their partners, and the partners had a real, over an 80, 90% satisfaction rate.
Wow.
I mean, I take all these numbers in lightly, because it's coming from probably research that the company did. But the point is, and the reason I believe that it is really high, is these guys have exhausted all of the other treatment options that we've previously talked about.
Sure.
Once they go here, they've most likely, I would say 99% of these guys have tried one of the options that we've been talking about. Mm-hmm. So they probably haven't been able to have adequate sex in a really long time. And this is what you would call a cure. I mean, you are definitely going to get an erection for as long as you want. It's not going to go down. You don't have to take a medication. There's really no side effects other than the fact of what can happen when you have surgery, which is a huge thing you want to consider. Mm-hmm. Once you're out of surgery and you had no complications, it's a cure. You're going to get an erection. So I think that's why you have a high patient satisfaction rate.
And is ejaculation the same?
It's exactly the same because
Okay.
you're not going into the corpus spongiosum that houses the urethra. So you're not damaging the urethra whatsoever. And the sensitivity, now I haven't had this done and I've talked to some patients. They tell me the sensitivity is the same.
Huh.
I would think that there has to be a little bit of a diminishment simply because there's going to be some nerve damage. Anytime you take a knife to anywhere on the body, there's going to be some nerve damage. However, they're doing it at that area that I discussed earlier where there's not as much.
Right.
And so...
Yeah, that's not the most sensitive part of the penis.
Correct.
At all.
Correct.
Okay. So, and then you could obviously still have your penis pumped up for a blowjob as well, for receiving oral sex.
Anytime you want to get a hard-on...
You could have it all day.
You can pump it up. You can have it all day. And you don't have to worry about what we talked about earlier. So you're not going to have any tissue damage because
Right.
you have no tissue in there.
Right.
So when people say this is a cure for ED, I mean, I guess in a way you could say that. Now,
Side effects?
it's expensive.
Or it's expensive?
It's expensive, Okay. Also, surgery is a big deal. It really is. There's lots of things that can go wrong. You're under anesthesia in an OR, right? There can be infection. There's infection issues. I've done one of these where there was an infection. They had to go back in, take it out, right? Put a bunch of antibiotic. Surgery's no joke. So that's something that, that's why I think that these guys have tried other options before they go down this road, because I don't think any of us take surgery lightly.
Right.
Right. None of us are going to just jump into that without seriously considering what the issues are. There are a lot of insurances that are covering this now. And I even did a transgendered prosthesis surgery 3 weeks ago, and it was paid for by an independent organization.
Awesome.
And then also some of the government agencies are covering it for some transgendered patients. Obviously, veterans have really good coverage. So
Okay.
yeah.
Okay. Well, so those are really the options that you're seeing.
Medically, that's pretty much what we're talking about. There's other people who have talked about PRP treatment, which would be platelet-rich plasma.
Okay.
Essentially, what they're doing is they're taking healthy cells from other areas, putting that into the penis, and then pretty much what my understanding of that is that the healthy cells kind of teach the unhealthy cells or start to replicate more healthy cells. Now, I guess what that could do is improve, I guess, if you have epithelial damage, meaning the lining of your arteries, maybe it could help heal that, which would help you, like if you had some sort of atherosclerotic plaque, it would maybe diminish that, so then you could get, I don't know. I mean, I'm just saying what would be the applications. I know they're using it for like knees and elbows and stuff like that, so maybe there's an application in the penis.
Okay.
Again, like when we're talking about there's all these different ways of getting to ED, and so it would have to work on a certain patient type that it would help. Like, for instance, if he has low testosterone, that's not going to help.
Right.
It would have to be one of the other things.
Okay. And you had actually, I think it was you when we talked about this once before, those over-the-counter, the ones at like 7-Eleven.
I'm glad you brought that up. So
yeah.
I've done a little bit of research on that, and these are they're herbal options. So again, let's go back to what we talked about. 50% of men aren't getting to go on Viagra. Well, that's an option for these guys. And one of the most powerful components of these pills that are sold over the counter is yohimbe root.
Okay.
And it has a really amazing reaction. I've tried it. I had a strong erection for a couple days. It went down, but if the wind would blow, that thing got up again. It was much stronger than PD5 inhibitors.
Huh.
You can buy them at 7-Eleven now. And I think they're like a couple of them are called Rhino. There's one called Black Mamba. They're small pills. There's one, and they have really colorful packaging. They're behind the counter. If you ask the guy, what do you have to get men going, or if I kind of make my arm go up like an erection, and if the guy speaks Spanish or whatever, he'll know what I'm talking about. Now they're about $12 to $15 a piece. So that's probably around the cost, maybe a little bit less of what you'd pay for Viagra. Definitely more than what you would pay for generic sildenafil.
Right.
But they work.
Okay.
And I remember you and I talked about that. So that's an option for people. And I think some men are a little bit afraid to take something over the counter. Obviously, we know when we take medications like Viagra, it's FDA approved. So we know it's gone through that process. Now, these haven't because they're herbal, so they don't have to. But, you don't know what you're getting. But there's a reason that every one of these liquor stores and every one of these 7-Elevens has these things because they work.
Okay.
So that's an option as well.
Absolutely. Okay. Well, that's really interesting. And we started to touch on this earlier regarding all of the different things that have to be working on the same page in order for erections to occur.
Right.
And that speaks a lot to just general male sexuality.
Right.
And performance anxiety. And
yes.
And you said something to me when we were talking about this over lunch and how in our society, we really equate erections with intimacy.
Yes.
And maybe that's not the best path to travel down. Can you speak a little bit more about that?
I think that men, and I don't know if it's, strictly adhered to this country or whatever, but we are socialized to equate, right, our sexual prowess with erection, and not only that, but maybe porno style vaginal penetration. I think that's kind of a lot of us get our first sexual education from watching pornography, and that is not sexual intimacy to me. I think that that's the wrong message to send. I think that you can have a wonderful sex life without that type of, let's say aggressive vaginal penetration, in and out aggressively. I think that a partial erection is great. You can still have sex. You can have amazing intimacy, and that's just as important as any other type of sexual expression, right? There's not one better than the other. So I think, again, I'm glad you brought that up, because I think we need to give ourselves a break. We need to realize that we don't have to have these certain types of erections to have a great sex life. There are things to help us now. And as long as we feel that we're having intimacy with our partner, that's really the goal. It's not, I say vaginal penetration. Obviously, there's other types of penetration for other partners,
other orifices,
other partners, right? So I don't want to strictly say that, confine it to that. But yeah, it's not about penetrating anything and having, an erection to do so. We can express ourselves sexually without that norm that we've been socialized to feel is what it means to be a man sexually.
Okay, well said. And I'm found myself curious. Have you ever heard a urologist say something like that to somebody, or
absolutely not? And I think the follow up is an issue, and I think that there's a huge psychogenic component to all this, what we're talking about. And maybe that's something that we can talk about, in another discussion.
Yeah,
but
that'd be
but
great.
100%, if you are anxiety ridden, okay, that changes your constriction, your vasodilation, all the way the blood flows through your body. And that's going to affect how you perform. So there's a huge part of it that's psychological. And as you mentioned earlier, there's so many different moving parts that we don't know which one actually causes what, right? So that should always be an adjunct part of therapy. And urologists don't bring that up. One of the things that I try and talk to endocrinologists about is the fact that diabetes affects like 3 components out of that 5-tiered system that I talked about. Diabetes affects your hormonal output, it affects your nerve innervation, and it affects your vasculature. Endocrinologists who generally treat diabetes don't even bring up erectile dysfunction to these guys. Studies have shown that as you improve erectile dysfunction, those men are more likely to make lifestyle changes, which saves their lives, right? So once they're having sex, their sugars go down. There's a corollary system there. Now, endocrinologists should mention erectile dysfunction to diabetics, and they should mention the fact that they should have a psychogenic therapeutic part of that, right? So I think that should be a part of that, because study after study have shown that those particular men, when their ED becomes better, their life expectancy goes up, their sugars go down, their depressive symptoms are reduced because they're getting laid.
Yeah.
So like, if you can't have sex, it's like, maybe why would I give up cigarettes? Why would I not eat what I want to eat? But oh wait, I can start having sex again? Yeah, maybe I will lose that extra 10 pounds. Maybe I will start working out. And so I think 100% that doctors should refer them to somebody like you, and also say, hey, let's also treat your ED while we're at it.
Absolutely. It's again shocking to learn when yet another field of doctors isn't talking about sex.
Right.
When it's anytime I've ever gone onto Google Scholar and looked at, okay, what's the latest on erectile dysfunction literature, it's never more than 3 or 4 down before there's a mention of diabetes. Like it's always, that's where a lot of the research is going.
Yes.
But so somewhere in there, either they're not reading their JAMA,
right,
or they're just not the taboo. They're not bringing it up in there. But it's a really common side effect.
I think that they're busy, right? These doctors are seeing a lot of patients. ED is a long conversation. That's why a lot of the doctors bring in somebody like me, because they'll go, "Hey, I'm going to bring in Max. He's an erectile dysfunctional. He's an ED specialist, and I can sit there with the guy for a half an hour because there's so many different questions." The doctors, a lot of times, they don't have time. These endos, they're not paid to treat ED. They're paid to get the guy's sugars down.
Okay,
because that's going to save his life.
Right.
After that, he's like, "I got 25 people in my waiting room. I can't sit here for 20 minutes and discuss your sex life."
Fair
now,
enough.
Is it that they don't care? Is it that they're too busy? Is it that they're not paid for it? Those are all things we can discuss. But the fact is that you just nailed it. They're not having that conversation for whatever reason.
Regardless of the reason.
Yeah.
Okay. Well, gosh, this has been such a great conversation.
Yes. Yeah. And I think we just like barely hit the tip of the iceberg.
Yeah.
So
we'll thank you so much.
You're very welcome. I loved it.
Yeah. And hope to run into you out in the field soon and keep having hard conversations.
Yeah. All right, Tim. I'll talk to you soon.
Thank you. Thanks to the show's executive producer, Robin Morrison. Thanks to Kat Murphy, director of social media. Thanks to Team Scrub for the music. Thanks to the sound engineer, Ravi Carmen. Thanks to Brian Hui for naming the show. Thanks to Alex Pitts for the intro. Thanks to Arlene Asuncion for the logo. You can find this podcast at hardconversations.com or wherever you get your podcasts. You can locate me on Twitter at TimNortonLCSW or on my website for my private practice, timnortontherapy.com. You can also email us at hardconversationspodcast@gmail.com or call into our hotline at 662-626-4276. That's 662-MAN-HARD. Thanks to all my friends and family for brainstorming this show with me. Shout-outs to the sex-positive community, including sex educators, sex therapists, sex coaches, other fellow sex podcasters, sex surrogates, academics, the sexual health medical community, sex workers, the tantric community, and everybody else involved with having hard conversations.